This video is an example of a patient who had a dislocating shoulder whenever she lifted her arm in a forward position. Her shoulder would dislocate out the back of her shoulder joint, what we call posterior instability, and was quite painful for her. In the beginning of the video, one can see how her shoulder capsule is quite patulous, and it is difficult to even visualize the humeral head on the top of the screen. One can also visualize the glenoid towards the bottom of the screen. The first step is to abrade the capsule to make the capillaries bleed to enhance healing when we plicate or tighten up the ligaments. This first stitch is placed at the bottom of the shoulder joint, and a monofilament blue suture is brought through the capsule into the labrum. We will exchange this monofilament absorbable blue suture for a very durable braided suture. To the right of the screen, a clear cannula like a straw is brought into the shoulder joint, and a crochet hook is used to bring the blue suture out of the shoulder joint, and the braided suture is able to be exchanged for the blue monofilament suture. The braided suture will be brought back to the top of the shoulder joint on the right side so that we can go ahead and place another stitch into the capsule to tighten up the bottom and back portion of the shoulder joint. By tightening up the ligaments in the bottom and back portion of the shoulder, the hope is that the patient will not dislocate her shoulder again out the back of the shoulder. The hope is that by tightening the ligaments in the bottom and back portion of the shoulder joint, that the humeral head will not dislocate out the backside of the glenoid. Here, our curved tissue passer is brought in to again grab a piece of capsule and then pass through the labrum as we tighten up now the posterior inferior aspect of the shoulder joint. Again, a monofilament blue suture is delivered into the shoulder joint, which will be brought out a separate cannula and exchanged for another braided suture. This process is repeated a couple of more times. This cannula shown in the background is approximately 7 millimeters in diameter, and the other cannula at the top portion of the shoulder joint is 5 millimeters in diameter. Once all these sutures have been placed, we will then start tying the sutures, which will secure our plication and tighten up the ligaments in the bottom and back portion of the shoulder joint. At the beginning of this video, the humeral head was almost not in the screen, as it was at the top of the visualized field, indicating that the ligaments were very loose. Now, as we start to tighten the ligaments, one can see that the humeral head is much closer to the glenoid, indicating that the ligaments have been shortened and that the shoulder joint itself has become much tighter. The surgery tightens the ligaments, but the healing process occurs over the next 4 to 6 weeks. So it is imperative for patients after the surgery and many shoulder surgeries to follow the postoperative instructions and remain in their sling to allow the soft tissues to heal before the patient resumes unrestricted activity. Additional sutures are then added into the shoulder joint, and the final view shows that the back of the shoulder has been tightened up, and the patient will no longer be able to dislocate her shoulder out the back of the joint. The front view of the shoulder shows a normal appearing labrum and socket,